To channel. Now we are going to start the surface landmarks of popliteal fossa. So first you need to understand where it is located. So actually it is located on the posterior side of your knee. You can see here, this is the femur bone, right? This is the tibia, this is the fibula. You know the tibia is the medial bone of your leg and fibula is your lateral bone, right? So on the back side here, this is the location of popliteal fossa. Actually it is a diamond shaped structure, okay, depression, which is felt at back of a semi-flexed knee joint and mainly contains a popliteal vessels, two terminal branches of sciatic nerve. Actually, you know the sciatic nerve, it divides into the tibial nerve and the common peroneal nerve at the site of this popliteal fossa only, okay. And popliteal artery is also used for auscultating while taking blood pressure. Actually, if you remember the femoral artery only, which is coming at this popliteal fossa, that is called as popliteal artery, and it is mainly used for the auscultating while taking blood pressure in lower limb. So you also have common peroneal nerve which lie on the neck of fibula. Common peroneal nerve is actually the nerve which is going to the fibula. At the neck of fibula it's most frequently injured, and if it is injured then it will lead to paralysis and lead to foot drop. The position with inability to dorsiflex and divert pose. The person who have this problem, they can't dorsiflex and also they cannot evert the foot. So now let us study introduction main about the popliteal fossa. It is a shallow depression felt best at the back of knee joint. When the joint is semiflex, it corresponds to cubital fossa of forearm. So if you remember, this is the cubital fossa of forearm, right? So the cubital fossa of in the upper limb, as we have discussed the cubital fossa, in the lower limb you will have the popliteal fossa, okay. So they are like homologous with each other. Now let us see the surface landmarks. Actually, laterally and medially you will have the condyles of femur. You can see this, for example, let us find out which is medial side, lateral side. By means of tibia and fibula, I can find out. As there is fibula, it is lateral side. As tibia, this is medial side. So this is the medial condyle, okay, of the femur, and this is the lateral condyle of the femur, right? So medial and lateral condyle of femur and tibia can be identified easily on the sides of front of knee, right? And coming to the head of fibula. Head of fibula is a bony prominence situated just below posterior lateral. Yeah, actually if you see on the upper side, this is the lower side, right? In the upper side you will have the head of fibula, which is a head of fibula is here, sorry. Head of fibula is a bony prominence situated just below posterior lateral aspect of lateral condyle of tibia. I say this is a medial condyle of tibia, this is lateral condyle of tibia. So just below the posterior lateral side of lateral condyle of tibia, you will find the head of fibula. Okay, so this is a posterior aspect of lateral condyle of tibia. So now come this side here, the head of fibula. Next coming to the common peroneal nerve. Common peroneal nerve can be palpated against the posterior lateral aspect of neck of fibula. Here you can actually palpate the common peroneal nerve, and which is medial to the tendon of biceps femoris. If you remember, the biceps femoris is a backside muscle on the femur, that is on the posterior compartment of thigh, right? So the biceps femoris, so medial to the tendon of biceps femoris, you can see the common peroneal nerve by moving the finger just below upwards like this. If you palpate here, you can easily feel the common peroneal nerve, okay. Now coming to the fibular collateral ligament. Of course, there are collateral ligaments which is forming the knee joint. So fibular collateral ligament of knee joint is felt like rounded cord just above head of fibula in a flexed knee. So just above. So just above the head of fibula, you get the fibular collateral ligament, okay. And especially in flexed knee, you can feel it. Next, when the knee is flexed against resistance, the hamstring muscles can be seen and palpated easily right up to their insertion. So medially, the rounded tendon of semitendinous lies superficial. You can see here the tendon of semimembranous, right? And also actually in the semimembranous tendon only you have semitendinous tendon. So when the knee is flexed against resistance, hamstrings can be seen, palpated right up to insertion. Medially rounded tendon of semitendinous lies superficial to flat tendon of semimembranous. In front of this tendons, there is a groove bounded anteriorly by tendon of adductor magnus. Even the tendon of adductor magnus will be here, because actually one thing you need to remember that from above, if you remember the femoral triangle, the femoral triangle is connected to adductor canal. That adductor canal passes by adductor hiatus which is near to adductor magnus, right? From that adductor hiatus, it opens into the popliteal fossa. Okay, so adductor magnus have a hole in it that is called as adductor hiatus. From there it will come into the popliteal fossa. So next, laterally there is a tendon of biceps femoris. In front of this tendon there is a shallow groove bounded anteriorly by iliotibial tract. If you remember, the iliotibial tract will be passing here from the iliacus muscle, from the ilium, right? From the ilium you have ilium of hip bone, right? From there it will come up to the tibialis. In the name itself, it will attach to the tibia, right? So iliotibial tract will be there. Next, pulsations of popliteal artery can be felt in middle of popliteal fossa by applying deep pressure. So if you keep deep pressure like this in the middle of the popliteal fossa, then you can feel the palpations of the popliteal artery. Next, in the lower part of popliteal fossa, two heads of gastrocnemius. Of course, because gastrocnemius muscle is below like this here, right? So two heads of gastrocnemius muscle form a rounded counter cushions that merge inferiorly to the calf. So that can be felt here. So if you see another diagram, I'll show that. So in this diagram, you can clearly appreciate the two heads of gastrocnemius. This is the lateral head of gastrocnemius. This is the medial head of gastrocnemius. This is forming inferior boundary of popliteal fossa. And also there is a supplementary muscle on the lateral side of inferior lateral side of popliteal fossa, that is plantaris muscle. And on the upper side, if you see, there is biceps femoris muscle on the lateral side, and on the medial side you will see mainly the semimembranous muscle, gracilis muscle, semitendinous muscle, and also you will see the sartorius muscle. So these are all the different boundaries of the popliteal fossa. So this is about the surface landmarks, and of course we also added the boundaries here. In the next part we'll discuss about popliteal fossa in detail, like what are the contents in it, what are the boundaries, everything.